A big change is looming for retired police and firefighters in Ohio. The Police and Fire Pension Fund will no longer provide health care coverage.
For retirees over the age of 65 who are Medicare eligible, there will actually be a savings of more than $1,000 a year. But police and firefighters often retire after 30 years of service in their mid-50s. So those who are not Medicare eligible are being unexpectedly forced onto the private marketplace.
It's something we didn't see coming, and then all of a sudden it's thrown at you really quick.
These retired firefighters
Thank you so much.
Volunteer weeks of their time for the Firefighters for Kids toy drive, after spending years of their lives keeping you safe.
Doug and I probably almost 80 years to this community, and now we're struggling, and we've suffered a lot of injuries over our time and been exposed to a lot of toxic products. So we don't know what the future brings for us for health care.
Dave and Doug are among the 8,000 retirees who are too young for Medicare and about to lose their health insurance.
Hey, all we're asking is what you promised us. You promised us health care.
Columbus Fire Chief Kevin O'Connor says retirees and those about to retire were blindsided.
And the pension board will tell you, well, it was never legally mandated that we had to provide it. But when you provide something for greater than 3 decades and then suddenly change it, what's the expectation of those members who worked those 3+ decades? Their expectation was that you were going to continue to offer that.
The pension fund will provide a monthly stipend to non-Medicare members of about $1,100, less than half what family coverage will cost. But the stipend has to be used through a managed platform company called Aon, with few choices in doctors or hospitals. Here in Franklin County, for example, Nationwide Children's Hospital and the James Cancer Hospital are not covered.
And any firefighter retired who's living in Franklin County is not covered at either one of those institutions at any level. Not at a high deductible, not at a 50/50 percentage, at a 0% reimbursement because they are not in network. That's wrong.
Limited coverage that restricts what doctors they use, what hospitals they can use, and yet it's going to cost them more money.
Yeah, there's probably some truth in that sentiment. We did the best we could to analyze the market and set that stipend level at a level that would satisfy those costs to where they were before.
John Gallagher is the executive director of the Ohio Police and Fire Pension Fund.
Our healthcare trust was facing depletion in less than 10 years, and we had to take some drastic actions.
He blames the continuing struggle in Washington over the Affordable Care Act. He says the pension board must keep the pension solvent, and they're doing their best for health care.
This board is made up of public safety officers, and they're not going to abandon their members. 6 out of the 9 trustees are policemen and firemen. This has been very tough on them. It's been very tough on all of us.
And we are hearing from firefighters and police officers already who tell us that some of them are in the middle of cancer care that's going to have to come to a sudden and unexpected end on January 1st. At least one man said he was scheduled for a kidney transplant, cannot have it done anymore because it's no longer covered, the institution he was supposed to have that at. So very frightening for some of these firefighters.
What options do they have, Colleen?
Well, they can go to the private marketplace. They can buy what is being offered through this managed care system. It's going to cost them more money. Other than that, there's not too much at this point they can do. Now, we did speak to the head of the police union. You're going to hear from him coming up tonight on NBC4 at 11. They're all trying to figure something out. We'll, of course, stay on top of this. And we do want to let you know you have until midnight Saturday to sign up for some kind of coverage through this new system.
Oh, time and option. All right, thanks, Colleen.